My name is Leah. I live in the Chicago area and I am a cancer survivor. Never in a million years did I think I would have melanoma. I was young and healthy and I thought, honestly, I kind of felt like I was invincible. I have spent the last 10 to 12 years or so living and working in medicine and kind of just, enjoying my life as a young 20, 30-year-old. Right around 3 years ago today, I transitioned into a role as a dermatology PA. There was a mole on my upper back that I looked at and I remember thinking, that one looks different. I wonder if I should be worried about that. So I talked to the dermatologist I was working with. She took a look at it and decided to do a biopsy of it. 5 days after I got married, I found out I had melanoma. It was a shock. I think first question was, oh gosh, how bad is it? Definitely I was in a haze. Definitely I was more just kind of worried. I mean, as the day went on, my thoughts just started kind of rambling of like, oh gosh, what does this mean for my longevity? What does this mean for if I should have kids? What does this mean for my marriage of 5 days? What does this mean for just everything? So when I was diagnosed, I had surgery and the surgeon told me she was going to send off my testing for DecisionDx-Melanoma. And that was the Castle testing that would help to kind of stratify my risk and determine my 5-year survival rate, as well as some other important details of my specific case. It provided a world of relief. My 5-year survival rate was basically 99.8%. And so that helped to reduce my anxiety significantly. And because of my low risk of recurrence, there was no need for a sentinel lymph node biopsy. And that reassurance has been very helpful and reassuring, at least for me, living my life and going forward. Honestly, every single day, I probably think about it. Just the fact that I'm like 99.8, we're good. Because you always stress about that, especially when you have kids, I want to live long for him. And I think that there is this option out there to really reassure and provide the comfort to you to allow you to continue to live your life is huge. What I would tell someone who is going through this diagnosis is to get the DecisionDx-Melanoma test. Advocate for themselves, talk to their provider about it. If they aren't ordering it, have them connect with someone who can help them get it ordered. I have a lot of patients who will say they went outside with an umbrella every single day after their diagnosis, and I had a patient several years ago that got a diagnosis of melanoma and told me she didn't leave her house for 3 months because she was so scared of the sun. Having these videos and seeing people learning and living a normal life, I think, is important, so people can see it's a diagnosis that you can get, you can live through, you can take care of, and you can have reassurance on the back end. For me, I was very lucky because it was a good result and it was a good report, and it helped me to, move forward with my life. But I think even for patients, maybe it's not the most promising result. It is a very helpful tool for them to be able to plan going forward, knowing what their risk is, knowing what their potential risk for recurrence or need for future surgeries or lymph node biopsies. I think the ability to plan is what this test gives you.